Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care. Hello, everyone, and welcome to another episode of Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. In today's episode, I had the privilege of sitting down with returning guest Charles Bacchi. Now, some of you may recall Charles because he's been on the previous 2 years to talk about some of the initiatives of the California Association of Health Plans. And in this year's episode, he talks about some of the initiatives, including touching on the Office of Healthcare Affordability, the SB-HIP initiative, which I'll tell you has a little bit to do with youth and behavioral health. And of course, he talks about the upcoming conference where you can expect up to 1,200 leaders in California that serve in various roles. I encourage you folks to possibly attend this conference as well, like I do every year. We hope you enjoyed today's episode. Feel free to check out other episodes of Pop Health Podcast by visiting us on our YouTube channel or listening to us wherever you listen to your shows. Thanks, everybody. Enjoy today's episode. Charles, thanks so much for joining the show today.
Thanks, Gavin. It's great to see you again.
Yes, folks. I wish we can talk fantasy football on the show, but actually, I was prepping for the show late, and Charles was ready for the interview, and we were talking fantasy football. So I just want to do a quick plug for those of you that like fantasy football. Charles and I are both fantasy football guys, and we're recording this in the preseason or about to be preseason. So thanks for bearing with me, Charles, as I got my technical act together to get started. So we always like to start the show, Charles, with something about you that might surprise the audience. Maybe the fantasy football may perhaps have surprised the audience, but how about something else?
Yeah, I was really having trouble with this one because this is my third year in a row of doing this podcast. And so I'm starting to run out of interesting things about me. But I did remember something most people wouldn't know about me is that I spent some of years of my youth living on the island of Guam in the Pacific Ocean, which is a territory between the ages of like 3 to 8 years old. And my dad, everyone says, "Oh, were you in the military?" No, my dad was in politics, and the governor of Guam was facing a tough re-election campaign and came to the West Coast to try and find a political consultant to help him win his re-election, and that was my dad. And so he flew out there and helped the governor win his election and then flew the family out. My brother was born there, and so I grew up in what looked like a normal suburban neighborhood, except for the fact that there were dogs roaming free without leashes. The kids didn't wear shoes, and we had a jungle in our backyard. But it was a really interesting place to spend, that part of my youth. As you know, from the first one I did, I then went from there to a cattle ranch, which is a pretty huge juxtaposition. But interesting healthcare story is that we had the opportunity to go on some medical missions into the Philippines, into the southern archipelago, which is, the part of the Philippines that's under a lot of combat stuff. There's freedom fighters or terrorists, whatever you want to call them, depending on your perspective, in a lot of those islands. And they're back in the 70s, very, very primitive. And long story short, my dad knew that one of the chief doctors on the island of Guam, whose brother was the head of the Philippine Navy. And so he would put together medical missions to these southern islands to usually do like cleft palate surgeries and other types of things for the people there who really couldn't access medical care. And we would travel on Philippine naval ships. Wow. Because we would come under attack sometimes from the guerrillas. And sometimes the cannons would go off on the cruiser. We came under fire a few times, but it was really interesting to see. Again, this was the 70s, right? So some things changed, some things probably haven't. Probably some of those islands are still pretty primitive, but no electricity. Just really, really everything, was, dirt, right? Huts. There was no real raised floors and stuff like that. It was a really interesting experience and obviously one that was needed back then to kind of bring that medical care to people who really couldn't receive it. And it makes me thankful to be working in healthcare today to realize how blessed we are, because we all spend a lot of time in healthcare talking about how broken it is, or how this isn't working, or that isn't working, or it needs to be fixed. But I think we are pretty blessed, as annoying as our healthcare system can be in America, that we have the kind of access we do to the services that we do, and are able to have the kind of lives that we live. So there you go. There's my opening monologue for you guys.
Yeah. Well, that was a good one. A couple questions following up on that. So when you're doing these medical missions and you're a child in this military ship, what was your sense of safety at the time?
I thought it was the coolest thing ever. I mean, there was guys with machine guns walking around. Sometimes they would like throw a buoy over the side of the ship to do target practice with their machine guns. And I was like, this is awesome, right? I tried to get as close as I possibly could. When the cannons would swivel and go off, I thought it was great. I think the only time I was really scared was we were at we went to a local government official's house for like a barbecue, they were honoring us, right? All the doctors and everybody who had gone on this. And yeah, we got attacked, right? And so we had to flee in jeeps with guards. There was gunfire exchange. That was scary. That was definitely scary. And that's, I felt unsafe. And then on a couple of the islands, my dad was 6'4" with red hair and blue eyes. My brother was a baby with bright white hair and bright blue eyes. And so when we traveled in some of those remote cities, because they were cities, we attracted a lot of attention. And so sometimes the crowds would crowd around us, trying to touch us and grab us and feel our hair and stuff. And sometimes that got a little bit overwhelming as a kid, because you felt like you couldn't escape,
Yeah.
But yeah, other than that, I thought it was the greatest thing ever. Of course, now looking back on it, I'm like, Dad, what were you thinking?
Yeah. Man, what a childhood. So we know family is important to you, with those above and older than you, but also younger than you have kids. So off the air, I mentioned fantasy football. We were talking about that, and we're recording this episode here in early July to be released in late July. So we just had our 4th of July plans. Your kids are at a point now where you were sharing that they, for 4th of July, wanted to be with their friends, which gave you and your wife some time to kind of be with your friends. What about the rest of the summer? Are your kids just like, hey, Mom, Dad, no thanks, we'll hang out with our friends? Or do you guys have anything going on together?
Yeah, we have a couple of vacations, some very small ones, but we're now entering that phase in life where we've spent really a lot of this last year getting our oldest child ready to leave for college, and so a lot of the vacations that we normally would take turned into college tours, and then orientation is next week for her, and then we've got to worry about getting her. So we're kind of at that weird stage where it's like you've got kids, but they don't really want to be in your house anymore. But you've got to kind of get them out of the house. We did have one great family vacation. The one who's going off to college plays in a really renowned jazz band. As I know, there's still jazz bands. Yes, there are. And this is a really, really good one, highly competitive. And they got into the Mingus Festival in New York City. So this spring, all 4 of us flew out to New York City for a week and got to watch them compete, one of the 6 high schools that got invited. And then we just did all the New York stuff, Broadway shows and, Statue of Liberty. And that was a really good, taught my kids how to use the subway.
Yeah.
Which was, that's something that not everybody gets to do. So it was a lot of fun.
The subway system out there. I've been there once or twice, and I was amazed at how complex and efficient, effective, not effective, however you want to define it. It was just pretty amazing. So that's great. So let's talk about your organization, California Association of Health Plans, CAHP. Charles mentioned it's his 3rd time back. We like to have this episode because your organization does so much in the largest, most populous state in California. You talked about being under fire as a child, and the health plans sometimes come under fire, or there's just a lot. It's emotional work that you guys do. It's meaningful. It's probably the most important industry, healthcare, right? Mm-hmm. So tell us what's happening this year, Charles, with CAHP. What are some of the initiatives for you guys?
Yeah, so we represent all the health plans in California, and so they are doing business, in the commercial side, Medi-Cal managed care, which is our Medicaid program here in California, and of course, Medicare. If you have a license in California, you are a member of our organization. But yeah, being the biggest state, we're always pushing the envelope. We're always trying things that might be good or bad ideas. But we're not always leading as much as we like to think that we are. So, for example, we've created our own Office of Healthcare Affordability here in the state of California, which is tasked with setting spending targets for the healthcare system. It's sort of it's a governmental agency, kind of sprawls over a couple of departments. And it's a new thing, so it's obviously very exciting for some people, very threatening to others. And for us, trying to control healthcare costs and affordability is kind of who we are as health plans. As I said last year, everyone wants healthcare to be more affordable, and they want us to help them do it. But it's tough. It's complicated. It's expensive. And so trying to find ways to manage healthcare costs has always been challenging. So they set targets here in the state of California. It's a 6-year, 5-year landing plan. We start off with 2 years at 3.5% growth, 2 years at 3.25% growth, ending at year 5, a 3% growth target. They're going to be using data from us health plans to start off with to set a baseline for what our total healthcare spending is, and then measure from there. But they're also going to adopt sector-specific targets, like targets for hospital cost increases. They're looking at trying to come up with more value-based care metrics, looking at a number of different things that are going to be much more complicated than just looking at what health plans are doing. So a lot of work around that this year, a lot of work over the next few years getting it up and running, because in 2027, that's when we would be potentially liable for the results, right?
Okay.
Leading up to that, it's kind of all test runs and measurements, and that's kind of the big year. But we're not the first ones to try this. There's a couple of other states that have done it with mixed results. We're just bigger than they are, and a little bit more complicated because of the way our healthcare system is developed. So,
okay, so that's a big deal. That's a really big deal. So you mentioned potential accountability, and I'm learning in my career that the first few years are ramp up periods and testing and gathering initial data. Accountability, liability can mean different things. Are you able to share like an example of what that means, or is that still to be determined and how that plans would be held accountable or liable?
Yeah, this is one of the $1 million questions that hasn't been answered yet, and we keep asking it over and over again. What they're looking at doing is sort of a ramp up of enforcement, right? The beginning is, you show that you aren't meeting your goals, and the idea is to do a deep dive into the reasons why. Publish that publicly, and then work with the regulatory agency to try and fix it and see if there's ways to figure out what's wrong with the data, figure out where your problem areas are, what are your plans to address it, and sort of have this progressive enforcement.
Okay.
And the idea is to have several years of like trying to help people meet their goals. And then if you get to a certain point, and that's undetermined when that point is, then they can actually do various types of penalties. And of course, we all want to know, well, how big are those penalties going to be? Because if they're too big, now you're making it unaffordable, healthcare unaffordable. So they haven't gotten that far in their thinking. It's a moving target. And I think they feel like they have 3 or 4 years to figure it all out. And of course, we all want to know the answers today. So. Yeah,
no, that makes sense. We actually did an episode on this very topic a few months back with the Office of Healthcare Affordability. So definitely interesting new office of the government, and obviously impacts you guys. One question. Go ahead.
Sorry, I was going to mention just another initiative if you want to, or you still want to talk about that one?
No, yeah, let's do another one. Yeah.
Yeah. So another one I wanted to call out because I thought it was really interesting is the Children and Youth Behavioral Health Initiative.
Yeah.
This is another one where we're talking about, the idea is to have schools be a place where kids can connect to behavioral health care. And, And in practice, that sounds great. Most kids are in schools. It's a controlled environment, unless it's a high school. But the idea is to have not only just the services that they would get at the school in Medi-Cal, which are already covered, but also to try and connect them to other services for specialists, especially around the mental health and behavioral health area. And so that initiative is kind of in year 2 of sort of trying to work itself out. And the first test cohort just went live 7 days ago, and no one knows anything about how it's supposed to be working. So the fact that it's live is a little scary because there's no rules and there's no guidance yet.
Wow!
But it has a lot of promise, and I think that for the listeners, not only does it highlight the importance of mental health for kids and the role that health plans and providers take, but it also is kind of a little bit of a microscope or a telescope, however you want to look at it, of putting how disjointed the healthcare system is for kids, especially with mental and behavioral health needs, how hard it is to navigate. And just as an example, not only do the schools not talk to the plans, do the doctors not talk to the schools, do the county behavioral health departments don't talk to the doctors, who don't talk to the schools, who don't talk to the plans. But then you've got some school districts, that see providing behavioral health counseling to students as something they don't support, because they're in parts of the state that are maybe politically concerned about hot button issues with children's mental health. And you have other parts of the state that are like, yes, we want to bring as many mental health counselors and behavioral health counselors as we can into the school setting to help out kids. And so, we're caught in an area where there's not a lot of communication going on between all these parties, but then there's also kind of this overlay of some school districts really wanting to do this and some districts really not wanting to do it. And it's a foreign land for us. So, but it's very exciting. It holds great promise.
Yeah.
We have a lot of work to do to figure it out here in California.
Yeah, no, I'm glad you brought that up. I first learned, is it SBHIP? Is that like the acronym for it? So I remember hearing that at one of your seminars. So a quick plug, CAHP puts on periodic seminars, I think spring through like summer in Burbank, and folks from all over the state come. And I didn't know about this initiative. And I think a lot of our listeners, until you just mentioned it, probably weren't familiar. And you mentioned it just went live July 1st. Or this phase, I guess. Yeah,
it's like 40 schools, 40 school sites, and so it's then there's gonna be another phase, but yeah, it's going to be really an interesting rollout. It's going to be challenging, but yeah, the SBHIP money was money to prepare the schools for this.
Okay.
How they're supposed to be actually getting up and running to start billing us for the services and making referrals. So we'll see how it goes.
Okay, gotcha. To be determined. So you're not the one, working with your health plans just by yourself, right? Like you have a team who is working with your health plans. Can you remind us, or for audience members listening for the first time, tell us about how your team is structured there at CAHP?
Yeah, so we are a trade association. Like I said, we represent all the health plans here in California, and we really kind of have a whole series of regulators and purchasers that we have to advocate for our plans on behalf of our plans. So I've got a lobbying team which works with the California State Legislature. So they work on bills that are introduced by members of the Assembly or Senate. And we obviously take positions, come up with amendments. We lobby the legislature, we lobby the governor's office. And that's really driven by either what constituents are saying about that they care about healthcare, or it's driven by stakeholders that want something from the healthcare system that they're not getting. And so it's a pretty active area. We probably take positions on over 30 bills a year, which is a lot. It's more than most other trade associations do. And there's usually of those 30 some odd bills, there's about 12 that are huge priorities. That they're all priorities, but I mean like are really problematic or really, really good. And so we do that work. And then as part of that, we also lobby on the state budget. And that really relates to the Medi-Cal program. and sort of the decisions that are made around how to shape our state's Medi-Cal program. Then I have another team that's dedicated just to the Medi-Cal program. So they don't deal with the legislature, but they deal with all of the regulatory and contract issues that are going on with the Department of Healthcare Services. I have another branch which deals with the regulatory and legal affairs, which is really deals with the legal framework for regulating plans across all of the disciplines. I've got obviously people for communications because we got to get our message out. Yeah. We have Marjorie King, our member services person who helps us for our educational events like our seminars and our conference. But it's a small team, but we have a lot of help, and we bring in a lot of specialists to help us out with our work. And it's a good team, and there's always something going on because now, like, we've added the Office of Healthcare Affordability. Yeah. We've added the department that deals with healthcare access and information, HCI, which deals with collecting all payer claims databases from plans. So it just seems like every couple of years there's a new department, new agency regulating healthcare, and we're there to represent our plans in front of them. So,
yeah, you are there, and you're bringing these folks to your events as well, like these departments, these leaders. So I know I plugged it earlier, but encourage you folks that are listening that work in healthcare in California. You should be attending these and learning what's coming down the pipeline, what's active, and you have a chance to rub shoulders with a lot of these people, including Charles, who I usually greet at every event. So yeah, I really appreciate that. I talked about the seminars, but I didn't mention how folks can learn about them, Charles. We'll probably mention it at the end of the show, but if folks want to hear about these events, we'll talk about your conference here in a few minutes. Just since we're talking about, what's the website people can see what's happening?
www.healthplans.org. And if you go to our events sections, you'll find information about our last seminar of the year, which is coming up in August, on Medi-Cal, Enhanced Care Management and Community Supports, which are two initiatives as part of the CalAIM initiative. And then you can read about our conference, which will be, here's your hot tip for the day, although by the time people see this, it'll be too late. We're opening registration this week. So we're going to be, so by the time this airs, you'll be able to get registration information there as well.
All right. Sounds good. And I encourage you guys to check it out. I think, I don't know if they're sold out with exhibitors, but I know Charles.
I think last year we talked a little bit later. We may have a couple of spots left for exhibitors, but it is selling quickly. So if you are interested, be sure to contact us and let us know as soon as possible.
Yeah, I know I have attended or exhibited in the past at some of these events, and I've been late and almost missed it. So these events can sell out. So this is not just some marketing gimmick to try to get you to register. I don't work for Charles. I don't get anything out of this, but I encourage you guys, don't miss out. This is the group to be connected with for these events. So check it out. So you mentioned a couple initiatives, with SBHIP, with your efforts with the Office of Healthcare Affordability, but you also mentioned there's like 30 bills that you guys support. Is there anything else this year that you guys are currently working on that you think the audience should be aware of?
Yeah, I think some of them are kind of issues that we're struggling with as a country nationally that sort of manifest them themselves here in California. For example, there's been a big push at the national level to crack down on the use of prior authorization for healthcare services. This is when health plans request that doctors ask for permission before doing some specialty care. Most, this doesn't happen frequently. Most diagnoses and treatments that doctors make are approved and it's not an issue, but there are some where prior authorization is required. It drives people nuts, especially the doctors who have to fill out paperwork and exchange information back and forth with the plan. So there's been a big push by the American Hospital Association and the AMA at the national level to try and limit the ability of health plans to use prior authorization. So we're facing that here in California, sort of an echo of that. But that's been a perennial battle over the last few years that we continue to take a look at. And we're also just embarking on an interesting endeavor for us here in California, and that's looking at changing the essential health benefits. These are the benefits that every health plan is required to offer folks in California, and it was set by the ACA, and California adopted a specific small group coverage plan, and everyone has to provide that at a minimum in the state of California. But the state's just starting a process to re-examine that and see if there's additional benefits that people might want to add, which of course relates back to the Office of Affordability, because if you add more benefits, you probably are going to increase costs and make healthcare more unaffordable. But, I think it's time. It's been a decade, and it's worth taking a look at them and seeing if we have those healthcare benefits, or what they need to be. And so, those are just some examples. And then, we've had some real issues, and this is, again, a national problem, but, a lot of small rural hospitals have been struggling to survive. And, no matter what people seem to do to try and keep them running, nothing seems to work very well. And so, there's been a lot of pressure on plans to try and be part of the solution here in California, which we've tried to be. When we find out, and unfortunately we don't find out a lot of times until it's really pretty much too late, we try to do things like speed up our payments. And, in California, it's a capitated environment, so we make a lot of regularly scheduled capitated payments to hospitals and groups. Yeah. And sometimes we can speed those up and advance them and look at ways to try and help financially, keep some of these hospitals and facilities that are on the edge of solvency running for a little bit longer. But it just seems like this is their costs are going up, and I get that. And, they are having trouble making ends meet. But there's plenty of hospitals in California that are doing just fine. And, unfortunately, a lot of the solutions people look at help all of the hospitals, not just the ones that need it the most. And I think we're game to help those that are in distress, and try to figure out ways to make it work, but not by creating a whole new set of rules just for those hospitals. But it's a huge issue nationally, and I think Medicare plays a huge role in it. And I think trying to solve this on a state by state basis, probably really is what needs to happen. Is Medicare needs to figure out a better way to pay these hospitals with less requirements on them. But it all comes back to affordability, because every time a hospital goes under, it reduces access, which is bad, but it also means people have to travel further. And it also means what hospitals are left have to charge more, which then kind of creates this spiral of costs. And it's something I think we need as a society to get better hold of.
Yeah. And I don't have much to say because I don't have the solution. So it's just, that is tough. One of the things you mentioned is California there's a lot of capitated payments. And I just wanted the audience to be aware, in case we have folks who are new to healthcare or aren't familiar with that phrase, that the hospitals are being paid a flat per member per month rate based on members that are assigned to the hospital. Is that correct, Charles? Is there a better way you want to explain that, or is that about right?
Yeah, I mean, basically, we're sophisticated parties here in California. We've been doing capitation for a really long time. So, a health plan will approach a medical group or a hospital and say, hey, look, we have X number, 100,000 people in your area. We want to pay you a capitated rate. You agree to take this monthly payment, and in return, you see our patients. Yep. And if less of our patients come in than we anticipated, hospital, you get to keep the money. But if more of our patients come in, then we're not paying you anymore. And so it's called a risk arrangement. And so it puts them at risk. But the upside for them is they can bank on consistent payments from the plans, and they're not just relying on bills, like how many people came through each month. They know they're going to get a set amount every single month. And California is huge on that. And that's why we've been a leader in a lot of value-based and risk arrangements, where we're trying to incentivize providers to improve quality in return for accepting capitation payments, and get away from a healthcare system that is built on volume, right? A claims-based system. The more you bill, the more money you make. And we really have, in California, have taken a different approach, which is that, a claims-based system, while necessary in some areas, is not necessarily preferable if you're trying to actually change outcomes. Yeah. So.
Great. That makes perfect sense. Thanks for explaining it much better than I did. So we've talked about some of your initiatives. We talked a little bit about your seminars. We've hinted at your big conference coming up in October. Let's go ahead and focus on that for a moment. Tell us about this October conference that some people say is the event of the year.
Well, I think those some people are you, and I appreciate you saying that, Gavin. I'm not going to engage in self flattery or promotion. I appreciate you letting me come on. But our annual conference is in October this year. It is in most years. It attracts about 1,200. I can say that now because we set a record last year. About 1,200 attendees, which is pretty decent sized. We put together 2 days of content with all the things you would expect to see at a conference. I think the difference about our conference is that I talked about this last year is that we really attract a high number of health plan leaders and C-suite staff and other decision makers at the plans. And because of that, for everyone who attends, it's a really great opportunity for networking. It's a great opportunity to talk business, to learn about things. I mean, you mentioned earlier you learned about SB HIP through one of our events.
Yes.
And so we really try to put together, a topical agenda, and we bring in all of the chief, regulators and purchasers in California. So it's not just the plans. You've also got government officials talking about the programs that they want to unfurl here in California. It's a great opportunity for companies like yours and others to say, hey, what's coming up next year? Like, what are we doing on population health management? Where is that project? And how does my company potentially fit into it? And how can I work with health plans to help deliver on, what the goals are of the state of California? So yeah, it's really great. I mean, I've been going for 20 years since I started here, and technically, I actually spoke at our conference before I came to work at CAHP, on an issue where I was working beforehand. So I've actually been to more conferences than I've been here, but they're great. They can be a little stressful for me running around, talking to everybody, making sure everything goes off well. But as I mentioned Marjorie earlier, she does a great job. And so I think this is going to be another good conference this year. And we've covered some of the topics already. Children's and Youth Behavioral Health Initiative. We're going to have a really good panel on that with multiple departments that are involved in designing that program. We're going to be there to talk about how it's going and what needs to be fixed and improved. We're going to talk about population health management with the director of the Department of Healthcare Services. We're going to have, for those lawyers, we're going to have stuff about healthcare litigation. We're going to also have we have a couple panels of Medi-Cal managed care CEOs and leaders talking about the work they're doing in their local communities. And then we'll have a keynote speaker or two that usually are not really healthcare related. I like to mix it up. And our keynote speaker this year is going to be talking about, really trying to get a mindset around having a fulfilling life. It's a little self-helpy, but sometimes I think in healthcare we tend to work really hard because everyone's passionate about what they're doing, and sometimes it can be really rewarding, but sometimes it's really easy to burn out. And so the idea is to have someone come in at the beginning and talk a little bit about how to make sure we're making meaningful decisions in our lives and finding meaning in the things that we do, and making life more fulfilling. So yeah, it should be good.
That's awesome, man. And that's a great mix. I've been there a couple times, and yes, I plugged you. You didn't tell me to do that, but I've heard at least one other person say it's their favorite event or the event of the year. So when I say people, it's not just Gavin. Okay, and that person was unrelated to any of this. So if you work in healthcare, you work with health plans, I encourage you to check it out. By the time this episode is on the air, you will be able to register. And if you are considering sponsoring, exhibiting, you can check out opportunities there as well. Just another quick plug, Charles. Last year, I was able to rub shoulders with a couple of leaders there. And actually, one of the chief medical officers helped me with a personal matter, and helped something come to fruition that was totally unexpected. So yeah.
It's really great. I mean, it's amazing. The connections that people make, and you start to make friends too over time, because people change plans. but they usually stay in California. And so you start to, they become familiar faces. And, you start to see, even though there's over 1,000 people, I'll know a lot of them. I won't be able to remember all their names immediately, but I recognize them and appreciate their being there. Yeah, last year, I think there was some crisis going on with a regulator who happened to be at the conference. And we had like an emergency meeting in their hotel room, on a web Zoom with other people calling in from around the state. And I just thought to myself, like, wow, what a perfect, coincidence of factors, right? Like, you have an emergency, you've got the regulator right there, they're at the CAHP conference, and that's the kind of work that happens sort of behind the scenes. So yeah, it's definitely cool. And again, it's www.calhealthplans.org. And I would love to have you there and have you participate. So
awesome. And speaking of folks at the event, a lot of your staff are familiar faces to me nowadays, and they've stuck around with you. I think I may have asked you last year, but I want to ask you again. How are you keeping everybody together there at CAHP? Why are they still working there?
I wish I had some amazing, management style or some, tidbit I could share. It's a small organization, and so we don't have a lot of levers, right? I mean, we can't promote everybody all the time. There's only 12 of us actually in the office, and so really, the things that I think make it a great place to work is that everyone can have the chance to be a leader, even if it doesn't mean having a fancy title, because we have so many different initiatives and so many projects that I think it allows the staff to feel invested in what they're doing, is making a difference, and that they're getting to lead projects. The other thing that I think is great is just I love to learn. And this is an incredible opportunity to learn about so many things that you would have no idea. I mean, over the last year and a half, I became an expert on doulas. And I would never thought that, right? Like I know what they are, but it's absolutely fascinating. We're family friendly. Most of us have kids or had kids, and so we really understand that. Me especially, as I've shared with you guys. Yeah. And then I think personal relationships are really important because you've got to find a reason to want to come to work, and we've just been blessed that we've been hiring people who are good people, and are enjoyable to be around. And we can do that, right? This isn't 5,000 people where you're going to, just make some mistakes. So yeah, just, great group of people. I enjoy spending time with my staff. But, the only other thing I will say is that that maybe is unique is that I'm a boss who does not email and text after 5:00 at night, which I know that people are working after hours sometimes when things are busy, but I don't think, that I should be bugging them on the weekends and at night. I know I want to have time with my family. And so I try to do that as much as possible, but that's not very amazing, but I try to make it great. And, for those people who stick around, it's just, I'm blessed and I'm thankful every day that they're still here, and want to keep them as long as I can.
Awesome. Well, good words. So we've talked a lot. We've talked about the initiatives. We talked about the conference. We're going to wrap up today's episode. Charles, anything else before we close it out today?
No, just really, it's great. It's been great to meet you over the last few years and get to know you, Gavin. And just really appreciate all the work that you do and that 24-hour home care does as well too. It's just, it's a population that needs a lot of help. I know, my dad is getting close to, that stage in his life. And so just really appreciate you guys' support of our organization and partnership. So thank you guys very much.
Absolutely, Charles. Well, it's always a privilege to interact like this, but also in person at your events. Thank you so much for joining today.
All right. Have a good one, guys. Take care.
Thanks, everyone, for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.